Hi everyone. Today I want to share with you a question that was asked on a forum as well, and it triggered a lot of things that happen in my practice as well over the years. The question is, one of my patients is have braces, orthodontic, so they have braces. They had it now for nearly 2 something years. They keep failing to attend the appointments. They said they saying they only want it for fashion. The I'm just don't know what to do with this case. I want to finish the case. The patient doesn't attend the appointments. They don't really care about their teeth. They just they like the look of braces or something. And I'm not sure what to do. They miss a lot of appointments and I really want to do something about this case. And I want to share with you my thoughts on braces in general, or fixed braces or fixed brackets and clear aligners, and how we manage those situations in the practice, and how can these dentists manage these problems that they have. And I feel for them because it's a really annoying problem to have, because you are responsible for the case. And as long as you are a treating clinician, you're still responsible for the outcome. Patient could be getting cavities, gum disease, a lot of other problems. So they need to cut tie with this patient or establish some sort of boundaries with this patient. So first, for credibility, my name is Khaled. I have been a dentist for 20 years. I own my dental practice, Lakeside Dental Spa in Harvey Bay in Queensland. I took it from 1 chair to 10 chairs, from 3 staff members to close to 40 staff members over the course of 14 years. And you can check my details below for credibility. So I still do orthodontics in practice. And my background, I worked for a brilliant orthodontist in Egypt as a dental student. I was a dental patient as well. I was a braces. I had braces in my mouth. I worked as a new grad in an orthodontic practice. When I moved to Australia, I did my courses with Dr. Derek Mahoney on passive self-ligation demon system. I was a very heavily bracket uh, practice. And then over the years, I transitioned into aligners, and now probably I'm 100% aligner practice and don't provide braces in my practice as I used to in the past. And the reason of this transition, of course, clear aligners have, you can get beautiful results now with less risk of getting caries around the brackets if the patient doesn't have good oral hygiene, with less risk of getting gum disease or gum inflammation if the patient is not brushing well, less risk of emergencies and traumas related with braces. I can achieve some great results with clear aligners compared to braces now. So our practice is very geared into clear aligners now, but we still give the patient options. So let's go back to this question. Number one, we try to identify this early on in the consultation process. So in the consultation process, we discuss braces, we discuss clear aligners, we discuss the difference, the benefits of each one over the other. And we can tell sometimes now, especially with younger patients, oh, I want braces. And then we click down a little bit more, like, well, I'm just curious to know why do you want braces? And if the answer is more cosmetics, which certain age group, they still find metal brackets as a cosmetic thing or a fashionable thing. Oh, I like the look of them. I like having colors around them. I always worry. I step back a little bit. Wait, hold on. If you only want braces for the color or the looks, I can guarantee you, based on my experience, you're gonna love them the first few weeks. After 8 weeks, you'll get over them. You will stop brushing them. You'll stop looking after them. Not just that, you'll stop watching what you eat. So you go for hard food again and start to break them again, and your treatment will go downhill. I would like to hear from you. I want braces because I cannot be bothered putting aligners, or I feel like I'm the type of person I like something fixed in my mouth. I don't like to put things in and out. I would probably be more convinced, but it's only for cosmetics. I usually step back a little bit and just, okay, maybe come back when you're ready to align your teeth. If your main concern should be getting your teeth fixed, regardless of the appliance. So I'll be very wary when they say I want it for the looks. I like the colors. I'll be very, very careful with that patient, because again, they will be the ones giving you a hard time later on. Number two, now you're stuck with this patient that went through the system and they have braces and they keep failing to attend. They break the brackets, they're not brushing, they're getting white spots around their enamel, and you just can't finish the case. You just keep mucking around and breaking brackets, you're going back on wires. What can you do? You have to have a clear system in place that every problem that you encounter should be documented, and a letter should be emailed, sent to the patient, posted. Patient, if it's a young patient, and their parents should be involved in that as well. Every incident should be reported to the patient. So they fail to attend appointments, there is a letter sent to the patient. Hey, you have failed to attend this appointment. Let's reschedule that. Fail a second time, third time, there is a warning now. If you don't attend, we're going to terminate treatment and we're not responsible for the outcome. Here's a list of dents and orthodontists can remove your brackets if you don't want to come back to us to remove the brackets. So I get more serious with them. Their hygiene is not up to standards, photos taken, letters sent to the patients, their parents. Here's the plaque around the braces. We show them how to brush, and I'm still getting this white spot and this white plaque around the brackets. Another letter in 1 month, another letter in 2 months if they keep repeating this problem, and then a letter of warning to terminate, then termination. If you follow this process, first it makes the patient now more responsible. If they're still not responsible, not taking the treatment seriously, you are not liable if you decide to terminate the treatment. If this patient goes and complains against you and you have this system in place, the authorities will look at your records like, wow, you have given this patient every chance to correct their behavior and they still didn't look after their mouth. They didn't share, they didn't provide or fulfill the promise to you by looking after the braces. You are not at fault by terminating the treatment. Actually, we congratulate you that you terminated the treatment, because if you continue like that, the patient will get more caries, more gum disease, and have more problems. So with this patient that they need to start documenting things now. They need to start sending letters, warning letters, and termination of treatment if the patient doesn't change their behavior towards the treatment. So if you find this information helpful, make sure you like and share it with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel and you'll be notified when more videos are released. Thank you so much for listening to me. It means a lot to me.